So, strokes in older people. Strokes affect younger people as well. And a lot of what I've learned, interestingly, about strokes is actually since I've started managing strokes in younger people, which sounds slightly bizarre because I'm a geriatrician by training, and therefore you'd think that so I know about old people, but actually I've learned a lot about managing young people as well. So the number one point about strokes is that everybody with a suspected stroke needs to be admitted to a stroke unit. Okay, being admitted to a stroke unit is probably the most powerful evidence-based intervention for stroke. And in London, you won't have a problem with that because the system is really quite slick. But outside the country, you may find a lot of stroke patients admitted to what might call rebadged geriatrics wards, where they're not getting the sort of level of input they will get on the stroke units. Now in London, one of the things we did was make sure that people have to have there have to be a certain level of staffing on the wards. So we are told that we won't get paid unless we have a certain number of physios, OTs, speech therapists, and so on and so forth. And every year we're inspected and they come along and count our physios on the rota and they count the OTs. And if we don't have enough, we don't get paid the stroke tariff for the next year. And that's really important because actually the quantity of rehabilitation is critically important for stroke patients. Why do they need to be admitted to stroke units? Well, the answer is we don't really know. It's probably about doing lots of simple things consistently. It's not anything very clever. So getting people to a ward where they're managed by experts, making sure that their swallowing is assessed early on before somebody pours porridge into their lungs, making sure that people get them out of bed quickly but not too quickly, picking up common complications like pneumonia, cardiac arrhythmias, making sure that secondary prevention, which is aspirin, statins, warfarin for AF, and others which I'll come on to in a minute, are applied consistently and to every patient. That's what a stroke unit's about. And one of the biggest learning exercises I've had in stroke is realizing that a lot of medicine is about doing simple things consistently in every patient.